William Harris. I've been tattooing in Charlotte for the past 27 years. I opened my traditional tattoo studio 10 years ago, which is Charlotte Tattoo Company off of Central Avenue. And recently I have opened the Hood Institute, which is a medical tattoo facility that specializes in areola tattooing for women who have undergone breast cancer. So it's a different technique from traditional tattooing, only because you're dealing with skin that has been has gone through possibly radiation, chemo. A lot of trauma has gone into that area of the body, especially if the women have had spacers put in, have had implants put in. You're dealing with skin that is very shallow. You don't have a lot of muscle and a lot of fatty tissue under it. So you have to be very gentle when working that area. So it does take a extra bit of training just to learn how to do that. I couldn't find anyone really to give me the training that I wanted for myself in the States. So I ended up finding a woman in Europe who thankfully was coming over to Boston. So I went and got trained by her. Her name is Vicky Martin, and she's kind of one of the, she's very prominent in the world of areola tattoo. Right now I would say it is probably 60% white and 40% black women. I also have worked on some trans men. I've worked on some women who have not undergone breast cancer, but actually had a breast augmentation where within that surgery something has gone wrong with the healing of the areola. Maybe a part of it kind of had to be cut off or cut out. So I've gone in and tattooed to make it look like it's full again. A lot of what I hear, because it's an emotional journey, the women have, and men for that case, have gone through a lot of surgeries, a lot of emotional kind of stresses throughout the past probably couple years to get to the point to where they come to see me. And a lot of what the women have expressed is that they want to feel whole again, and they want to feel like they're beautiful again, which we have to, I have to tell them that you are beautiful even without this. But in their mind, a part of them is missing, something that, was very important to them. I think that, it's one of those things where, from a woman's point of view, her sexuality, her femininity, a lot of times is associated with body image. And so once I kind of have given that back, from their point of view, the best thing I've always hear is when they tell me is the first time I got out of the shower and walked past the mirror and saw myself, with areolas again, it was, very emotional experience. And it also is when I tattoo them, the first time they get up out of the chair and look in the mirror, a lot of times there's tears, behind that. So usually after the surgeries, after the implants, you won't really come and see me for about 6 to 8 months after. So by that time, scarring has kind of, healed pretty well. The radiation of the skin, it has changed the skin a little bit, but it's at a point where we can kind of go in. It's not, the skin's not like paper thin, quite anymore. So we take every precaution to make sure, once you come and see me, it's just like you go get a regular tattoo. It's just in an area that you have to be real gentle with. Almost like covering scars. A lot of women sometimes come to the traditional tattoo studio to get, say, C-section scars or tummy tuck scars covered. And you just have to know how to proceed with that, because that scar is scar tissue that builds up. So a lot of times ink won't hold in that, very well if you don't know what you're doing. So it's just a matter of, learning those processes. A lot of times it's trial and error, because skin is not a piece of paper. It's something that living organ, and it kind of grows and stretches and all that. So luckily, with me having the amount of experience, like I said, almost 27 years in it, I've seen and learned a lot to be able to know how to proceed with, areola tattoo. What used to happen is oncologist offices and plastic surgeons offices, they used to have a nurse or, physician's assistant or something go in and do the areola tattooing afterwards if the client or patient wanted it. The problem is they had no training in art. They didn't know about shadowing. They didn't know about highlighting. So what they were putting on the women basically was just a circle for the areola, shaded in whatever skin color they wanted, and then a smaller circle for the actual nipple with a hard line around it, with semi-permanent ink, so it would fade out, very quick. That recently, really nobody does that anymore because the women were so unhappy with that. What I offer is something that's almost photorealistic, to where, from just the eye seeing it, unless you were to get like right up close to it and see, when you see it from a distance, you would think that it's a real areola. I mean, it has depth to it, it has shadowing, even like the wrinkles in the areola, the Montgomery glands, all of that is incorporated into the tattoo. And it's just happened, you just learn that from, doing studies, doing, drawings, that type of thing. I've even had women who have come in before their procedure and had photographs taken of their breast before, so that once the procedure is done, I could actually match their, the color of their areola, the size of their areola, all of that, because they wanted it to look as close to what they had before. When I first started, initially, things are based on, it's called the Fitzgerald scale. It's like it goes from, it's 5 or 6 different hues, and it goes from extremely pale, maybe someone like of Irish descent, to someone extremely dark skin. And we used to just adjust it based on that scale, like where you were. Recently, I have a technology that I can, especially if you have come in before your surgery, I can actually put it on your skin, like click a button, and it will tell me what inks to mix to make your complexion. So based on that, I can, if it is after the surgery and say you don't have the areola, I can use your skin complexion and then bump up the scale in order to make a tone that it would look right on, your complexion. And that's also very good for, say, if you've had a scar or something. I had a gentleman come in that had a surgical scar on his knee, where it was, when it was healing, it had scarred a little bit, and he went and had some shots in it to kind of take the keloid down. Well, those shots took some of his pigmentation out, and so now on his knee he had this huge, very pale spot, and he was pretty, kind of darker skinned man. So I matched his skin tone, went in, covered that area, and so now you couldn't even tell that he had that that scar on there. So that technology is fairly new in the past, year or so. Over here in the States, it's been in Europe for quite some time, but it's changed, lives. It reads skin color. So think if you have a wall, that you want to match the color, at Sherwin-Williams, you can take a little chip in there and they'll hold it under this little reader and it'll tell you what colors to make. This is basically the same thing, to where I would hold this on my skin or on the client's skin, push down, and then it tells me the code for the particular inks that I would need to pick to make your skin tone. You don't have to get it done. It's, you are beautiful and whole as you are. However, from what I have seen over the past, couple years, is that this procedure changes how you look at yourself. I guess in the grand scheme of things, that's, very important. How you view yourself, leads to, self-esteem, confidence. And so I think just, seeing that in so many, women over the past years, I would say, why not? It's something that could be very beneficial.